You recently experienced a cardiac event, and you may be experiencing some worry about what that means for your future. The good news is you are among the fortunate group who have survived and have the opportunity to make positive changes that will improve your health and well-being. There is a program that your cardiologist may have mentioned to you. It's called Cardiac Rehabilitation. Cardiac rehab has been shown to increase survival rates by up to 30%, lower the risk of having a recurring heart attack, and can reduce your heart disease risk factors by helping you make important lifestyle changes.
Research has shown significant benefit of cardiac rehabilitation service for individuals with cardiovascular disease. Several large studies have demonstrated mortality reductions of 20 to 30% after participation in cardiac rehabilitation. With cardiac rehabilitation, you have a team of healthcare professionals, including doctors, nurses, exercise physiologists, and dietitians who are here to provide the education and direction you need to get stronger and healthier.
By beginning cardiac rehabilitation as soon as possible following discharge from the hospital, we can help you put together a personal plan to improve your heart health and give you the tools and support you need to make healthy lifestyle changes to maintain a healthy weight, choose heart-healthy eating options, develop an exercise program, take your medications as prescribed by your doctor, and avoid tobacco and environmental smoke.
There are many factors that contribute to heart disease. Most can be improved by making changes. We begin with a personal assessment of your risk factors and then customize your experience to meet your personal needs. We'll create a personalized exercise plan designed so that you can maintain it for a lifetime. It is an individualized program which takes into account your recent cardiac problem. The program is designed to improve your heart and lung function and includes exercises such as walking, biking, or jogging. Your current fitness level and lifestyle will be taken into account when developing the program. And to give you peace of mind when beginning an exercise routine after experiencing heart problems, we'll monitor your pulse, heart rhythm, and blood pressure throughout your workout. During your time in cardiac rehab, we'll also help you monitor important numbers like your blood pressure, your cholesterol levels, your weight and body mass index, and your blood sugar level if you have diabetes. Many people see improvement in these key numbers after following an exercise routine for several months. Typically, cardiac rehabilitation consists of an hour session 3 times a week. Most successful individuals complete 36 sessions within a 12-week period. We realize this can be a very emotional journey for you. That's why we assess your emotional well-being and will help you manage the pressures in your life and to cope with your life-changing diagnosis. Aurora's comprehensive continuum of care provides access to counseling services that help you address the emotional side of your heart disease. You have a whole team behind you when you are in cardiac rehabilitation, encouraging you to make the changes you need to live a heart-healthy life.
Cardiac rehab is for anyone who has experienced any of the following diagnoses: a heart attack, coronary artery bypass surgery, heart valve replacement or repair, coronary artery angioplasty or stents, heart transplant, or stable angina. Our program offers coordinated care in communities throughout eastern Wisconsin. It is essential to select a cardiac rehab location that has your heart health history. At Aurora's Cardiac Rehab Program, our electronic medical records ensure an integrated approach to your care, so the clinicians you work with are well informed about your medical history, are aware of your physician's instructions, and work in partnership with your entire care team. Insurance companies generally cover cardiac rehab, but if you are not sure about your insurance coverage, you should talk with your insurance company or with a cardiac rehab program staff, and we'll be happy to assist you in determining your coverage. You will receive a phone call during your first week after discharge. It is important that you get started in cardiac rehabilitation as soon as possible following discharge. Cardiac rehab is designed to take into consideration that you have just been released from the hospital. It is an individualized program tailored to your own specific physical ability and will account for your safety and well-being. There is one thing you can do to live longer, keep you out of the emergency room, and lower your chance of being hospitalized in the future for heart-related problems, and that is cardiac rehabilitation. Take the first step and say yes to a healthier future. Say yes to cardiac rehabilitation and take an active role in your health.